Imagine you walk out to the barn one morning, and your horse, usually so vibrant, is standing a little stiffly, maybe trembling a bit. And then you hear it, this weird, rhythmic thump-thump sound, coming from their flank, right in time with their heartbeat. It's pretty bewildering, right? Today, we're taking a deep dive into something really vital for our equine friends. Equine hypocalcemia. That's basically a condition where horses have abnormally low levels of calcium in their blood. Our goal here is to really unpack the complexities of low calcium in horses. From the surprising ways it affects their bodies to how it's diagnosed and treated. We've gathered a lot of detailed veterinary research and clinical insights on this to guide us so you can walk away really understanding it better.
Yeah, and it's definitely an important topic. While thankfully severe hypocalcemia isn't as common in horses as maybe in cattle when it does happen, well, it can become a life-threatening emergency pretty fast. So getting a handle on the what, the why, and the how of this condition is absolutely crucial for anyone interested in horse health, or just anyone who spends time around them.
Okay, so to kick things off, let's talk about calcium's role. What exactly is hypocalcemia? I mean, simply put, it's when the total serum calcium concentration falls below that normal range. But what does calcium actually do in a horse's body? It's more than just bones, right?
Oh, absolutely. It's incredibly multifaceted, way beyond just building bones. Calcium is fundamental for blood coagulation, getting blood to clot. It's essential for muscles to contract properly and for neuromuscular excitability, which is basically how nerves talk to muscles. Plus, it's vital for hormone secretion and even activating all sorts of enzymes throughout the body. Think of it like a key operator for a lot of essential functions.
And it's not just one type of calcium floating around in the blood, is it? Our sources mention different forms: protein-bound, ionized, and complex. And apparently the ionized calcium is the really important one for how the body works. How does that play out, especially if, say, the horse's blood chemistry changes?
That's a really key point. Yeah, the ionized calcium, that's the physiologically active bit, the form the body can actually use. About half the total calcium is bound to proteins, mostly albumin. Now, what's really interesting is if a horse's blood gets more acidic acidosis, we call it, that actually increases the amount of free ionized calcium because less of it binds to the proteins when the blood is acidic.
So wait a minute, does that mean a horse could have a normal total calcium on a blood test, but still be functionally low on calcium if their pH is off? Like if they're alkalotic instead of acidic?
Exactly. If they're alkalotic, the opposite of acidic, more calcium binds to protein, so the ionized usable calcium level drops, even if the total number looks okay.
Wow, that's definitely a hidden danger. Makes sense why measuring ionized calcium is so critical then.
Precisely. It gives you the real picture of what the body can actually work with.
Okay, so given calcium does all these things, it stands to reason that when that active ionized calcium dips too low, the effects can be pretty widespread and dramatic. What kind of impact are we talking about across the horse's systems?
Yeah, the effects can be quite dramatic, hitting multiple systems. First, the musculoskeletal system. When calcium is low, the body gets desperate and starts pulling calcium out of the bones to try and keep blood levels up for other critical stuff. Over time, this can mess with bone formation, lead to demineralization, basically weaker bones prone to injury. Then you've got the neuromuscular system. This is often where you see the really acute, alarming signs. Low calcium makes nerves and muscles hyperexcitable, so you tend to see tetany, that's sustained muscle contraction or cramping rather than weakness, or paresis.
So not just weak, but muscles actually locking up. That sounds incredibly painful and probably confusing for the horse.
Exactly. And in really severe cases, you can even see seizures. Now, for the cardiovascular system, there's that classic, sometimes even audible sign, synchronous diaphragmatic flutter, SDF, often called thumps. This is literally a twitch or contraction in one or both flanks that happens right in sync with the heartbeat.
Right, thumps. That rhythmic flank twitching timed at the heart, that sounds so strange. What's actually causing that specific synchronized movement?
It's a really interesting neurological thing. Basically, the phrenic nerve, that's the nerve controlling the diaphragm, gets overly sensitive when calcium is low. It starts firing sort of abnormally, picking up the electrical signal from the nearby heart. So the diaphragm twitches every time the heart beats, like crosstalk on phone lines.
Okay, that makes sense.
And it doesn't stop there. The GI system can also be affected. Decreased contractility, which means things slow down. Hypomotility, ileus, basically colic signs. And in mares, low calcium can even contribute to reproductive issues, things like retained placenta or uterine infections, probably because the uterine muscle doesn't have the tone it needs, similar to how the gut slows down.
Okay, let's unpack this a bit more. So what actually triggers this crucial calcium drop? It sounds like there could be quite a few reasons. What are the big ones owners should really know about?
Yeah, the causes are pretty varied and sometimes they overlap. One of the most common and really critical for people with mares is lactation tetany, or periparturient hypocalcemia. This usually pops up around 10 days after foaling, or maybe a day or two after weaning. Essentially, the mare is putting so much calcium into her milk that her body just can't keep up. She can't absorb enough from her feed or pull it from her bones fast enough. Certain things make it more likely, like if she's on a lower calcium diet, maybe mostly grass hay without supplements, or if she's just not eating well. Interestingly, draft breeds seem to be a bit more susceptible, and often these mares are low on magnesium too, which complicates things.
Right. And magnesium's important for calcium regulation too, isn't it?
Exactly. We'll probably touch on that more.
Okay, what else? What about performance horses?
Ah, yes. Transport tetany or exertional hypocalcemia. This one hits horses after really prolonged exercise, like endurance rides, or sometimes just from the stress and maybe not eating during long transport. Horses lose a lot of electrolytes, including calcium, in sweat, big time during hard work. Plus, that stress or intense exercise can cause alkalosis, making the blood less acidic. And like we said, alkalosis reduces the ionized usable calcium because more gets bound to protein. Stress hormones like corticosteroids can also interfere with vitamin D, which is needed for calcium absorption, so it's kind of a perfect storm.
Makes sense. What about horses that are already sick?
Definitely. Endotoxemia and sepsis are common culprits in critically ill horses. Think severe colic, bad colitis, pneumonia. The reasons are complex. Systemic inflammation plays a role. Calcium can get sort of trapped or sequestered in tissues, and the body might have trouble producing or responding to parathyroid hormone, which normally helps raise calcium levels.
Okay, and diet. Can long-term diet issues cause it too?
For sure. Nutritional imbalances, usually chronic ones. Diets really low in calcium, or diets with way too much phosphorus compared to calcium, like feeding lots of grain or bran without balancing the calcium. This can lead to something called nutritional hyperparathyroidism, or NHP, sometimes called big head disease. Basically, the parathyroid gland goes into overdrive trying to compensate for the low calcium and high phosphorus. And in young, growing animals, if they lack both calcium and vitamin D, that can lead to rickets.
Right. Big head. Okay, any other major causes? Toxicities, maybe?
Yep, toxicities are on the list. Blister beetle toxicity from cantharidin is a nasty one. Horses usually ingest the beetles accidentally in alfalfa hay. It causes severe gut problems, kidney damage, and definitely hypocalcemia. The toxin is directly harmful to cells and also chelates calcium.
Binds it up, you mean?
Exactly, binds it up. Then there's oxalate toxicity. Certain plants, like some setaria grasses or even rhubarb leaves, are high in oxalates. These oxalates bind calcium in the gut so the horse just can't absorb it.
And sometimes can treatments cause it, like accidentally?
Yeah, what we call iatrogenic or drug-induced causes. Giving IV tetracycline too quickly can temporarily bind up calcium. Giving too much bicarbonate can cause alkalosis, which we know lowers ionized calcium. And using diuretics like furosemide excessively can make the kidneys excrete more calcium.
Okay, so lots of potential triggers.
And just quickly, a couple of rarer ones. Primary hypoparathyroidism, where the parathyroid glands themselves don't work right, very uncommon. There's a specific genetic form in thoroughbred foals. Equine familial isolated hypoparathyroidism, EFIH. It's autosomal recessive. These foals have low calcium, usually high phosphorus, low PTH. It's often fatal, unfortunately. And again, hypomagnesemia, low magnesium. It's crucial because magnesium is needed for PTH to be secreted and for the body to respond to it. So low magnesium often goes hand in hand with low calcium, or even causes it.
Right. That link with magnesium seems really important. Okay, this is where it gets really practical for an owner. What are the absolute first signs, the red flags you might see that make you think, maybe this is low calcium? What should you look for?
Yeah, that's crucial. The signs often relate back to that neuromuscular irritability we talked about. How bad they are depends on how low the calcium is and how fast it dropped. For mild to moderate cases, you might see things like anxiety. Maybe the horse seems unusually excitable. Subtle muscle tremor, sometimes just around the face, neck, or flank. They might seem stiff, take short strides when walking, maybe look a bit uncoordinated. It's ataxia. Other signs could be lethargy, just seeming depressed, not wanting to eat, decreased gut sounds, maybe mild colic signs. You might just think your horse is having an off day.
Okay, so it can be subtle at first. But for that horse we imagined earlier, the one trembling with a thump-thump sound, that thump is the SDF, what other really obvious signs point towards severe hypocalcemia? The things that shout emergency?
Right, when it gets severe into hypocalcemic tetany, the signs are much harder to miss. That classic synchronous diaphragmatic flutter thumps is definitely a key one, that rhythmic flank spasm. You'll also see more generalized muscle twitches, fasciculations, and tremors, an overall increase in muscle tone, like they're rigid, severe generalized stiffness. In really bad cases, the horse might go down and be unable to get up. That's recumbency. Other severe signs include profuse sweating, sometimes cardiac arrhythmias, which are rare but serious seizures or convulsions, especially in those EFIH foals we mentioned. You might even see the third eyelid prolapsed or trismus lockjaw. These are all signals for immediate vet help, no question.
That's a scary list. So if you see some of these signs and the vet suspects hypocalcemia, how do they actually confirm it? What's the definitive test?
The gold standard for diagnosis is measuring the ionized calcium concentration, the ICO. Like we discussed, that's the active form the body uses. But it does have challenges. You need special handling for the blood sample, collect it without air exposure, analyze it quickly, or keep it properly chilled on ice. Otherwise, the reading can be inaccurate.
Right. And just measuring total calcium isn't enough, you said.
Yeah, it can be really misleading. Total calcium levels are affected by things like blood protein levels, especially albumin, and the blood pH. So a horse could have normal total calcium but still be critically low on ionized calcium, especially if they're alkalotic. And those corrected calcium formulas people use in other species, they generally don't work reliably in horses, so you really need that ICA measurement.
Got it. Ionized calcium is key. What other tests does the vet usually run alongside that?
Well, you absolutely always measure magnesium because low magnesium can cause or worsen hypocalcemia, and you need to treat it if it's low. Measuring phosphorus is important too. Remember, it can be high in primary hypoparathyroidism. Checking kidney function, BUN, and creatinine is standard. And assessing the acid-base status with a blood gas analysis helps identify things like alkalosis that affect ionized calcium. Measuring parathyroid hormone, PTH, levels gives huge clues too. If PTH is high when calcium is low, that suggests the body is trying to compensate, like in lactation tetany, transport tetany, or NHP. But if PTH is low, or maybe just inappropriately normal when calcium is low, that points strongly towards primary hypoparathyroidism, like EFIH in foals.
So it's really about piecing together all these different clues, the calcium itself, the magnesium, the PTH response.
Yeah.
It's not just one number.
Exactly, it's the whole picture. And then, of course, if you suspect something specific, like blister beetles, you'd look for beetles in the hay or test the urine for cantharidin. Early urine samples are best for that. Or if it's a foal with the typical signs, you might do genetic testing for EFIH.
And I guess you also need to rule out other things that might look similar, because stiffness and tremors could be other problems too.
Absolutely essential. We call those differential diagnoses. Things like tetanus, though, usually their calcium's normal and they don't improve with calcium treatment. Strychnine poisoning can also cause severe muscle rigidity, but again, calcium is typically normal. Exertional rhabdomyolysis, tying up, causes muscle stiffness and pain. Laminitis causes reluctance to move, but blood work, like muscle enzymes for tying up and other clinical signs, usually help tell these apart from hypocalcemia.
Okay, so the diagnosis is confirmed. It's hypocalcemia. What's the game plan then? How do vets treat this, especially if it's an emergency?
Right. For acute severe hypocalcemia, the main treatment is intravenous calcium, usually calcium gluconate solution. This is absolutely an emergency treatment, and it needs extreme care. It must be given very slowly, typically over 20 to 30 minutes, or sometimes as a slow, continuous drip. And this is critical. You have to be listening to the horse's heart rate constantly with a stethoscope during the entire infusion.
Why is that continuous heart monitoring so incredibly important? What's the risk?
The risk is that calcium is cardiotoxic if given too fast. Rapid VEITH infusion can cause serious, even fatal cardiac arrhythmias, like a dangerously slow heart rate, bradycardia, or heart block. If you hear any arrhythmia develop or the heart rate drops significantly, you have to slow down or stop the infusion immediately until the heart stabilizes. It's that serious.
Wow. Okay. Slow and steady with constant monitoring. Got it.
And if the horse is also low on magnesium, which is common, giving intravenous magnesium is also really important. It helps the PTH work better. Fluid therapy is usually needed too to correct dehydration and other electrolyte imbalances that often go along with these conditions.
Okay, that covers the immediate crisis.
Yeah.
What about after that? How do you manage it long-term and address the root cause?
Yeah, fixing the immediate low calcium isn't enough. You have to tackle the underlying reason. So, for lactation tetany in a mare, that means getting her onto a high-quality diet rich in calcium. Alfalfa hay is great for this, plus calcium supplements. Sometimes you might even need to temporarily wean the foal or reduce its nursing time to decrease the drain on the mare. For transport or exertional tetany, it's about adequate rest, rehydration, electrolytes, and making sure they have access to calcium-rich forage, especially during stressful periods or heavy work. If it was a toxicity like blister beetles, obviously remove the source, get rid of the contaminated hay. Then it's supportive care for the gut and kidneys. If sepsis is the underlying issue, you have to aggressively treat that primary infection. And for those rare cases of primary hypoparathyroidism, management is tough. It usually involves long-term oral calcium and vitamin D supplements, but it can be challenging to get right.
Right. So
Yeah.
tailored treatment based on the cause.
Exactly. And then for ongoing support or prevention in at-risk animals, you might use oral calcium supplements like calcium carbonate, often with vitamin D to help absorption. Dietary management is key overall, ensuring a balanced diet with the right calcium to phosphorus ratio, ideally around 1.1 to 3.1 for adults, maybe up to 6.1 for growing horses or lactating mares is sometimes recommended. Again, alfalfa hay is a really good source of dietary calcium. Minimizing stress during transport or hard work is also a big part of prevention. And, of course, continued monitoring of calcium levels, especially that ionized calcium, until the horse is stable.
Makes sense. And what about the prognosis? How well do horses typically recover?
It really depends heavily on the underlying cause. The good news is that acute hypocalcemia from things like lactation or exercise often responds really well to prompt calcium treatment. Those horses usually make a full recovery. But for conditions like primary hypoparathyroidism, or if the hypocalcemia is due to severe sepsis, the prognosis is often more guarded, either because the condition itself is hard to manage long-term or because the underlying disease, like sepsis, is so severe.
Wow, what an incredible journey into equine hypocalcemia. It's really amazing how something seemingly simple like an electrolyte imbalance, low calcium, can cause such huge, varied problems across the whole body. Muscles, heart, gut, even reproduction. It definitely drives home how important it is to recognize those signs quickly, get a proper diagnosis, maybe even prevent that scary thumping sound from starting.
Absolutely. This deep dive really shows how knowledge is power when it comes to equine health, doesn't it? Understanding calcium's role, all those different functions, helps connect the dots between diet, exercise, stress, and these potentially very serious medical issues, and hopefully empowers you as someone who cares for horses.
Yeah, definitely. And it leaves us with a final thought to chew on. Given how absolutely essential calcium is for so many different body functions and how relatively easily its balance can get thrown off in horses,
Yeah.
what other seemingly subtle imbalances, maybe other electrolytes or minerals, might be having widespread dramatic effects in the body that we often overlook? Something to think about.